Good afternoon, Bermuda, and welcome to the members of the media who have joined us. Today, I am joined by the Minister of Health, the Honorable Kim Wilson, who will be providing an update to the public on the latest regarding the coronavirus and other matters within the Ministry of Health. Following that, I will give an update on matters related to the violence that took place over the weekend in our community. I will touch on education and the technology that will be used to help reduce the incidence of COVID in our community. First, will be the Minister of Health. Minister?
Everyone. Yesterday, there were 764 test results received by the Ministry of Health, and one was positive for COVID-19. The most recent case is classified as imported, having arrived on BA Flight 2233 from London on the 22nd of October, 2020. The case, a resident, was asymptomatic and received a positive test result on their day 4 test. Case isolation and contact tracing has begun. Bermuda now has 194 total confirmed positive cases, and their status is as follows. There are 10 active cases who are all under public health monitoring, and none are hospitalized or in critical care. A total of 175 have recovered, and the total deceased remains at 9. The average age of all of our confirmed positive cases is 55, and the age range of all of our positive cases is from 7 to 101 years. Overall, 49% of cases were black, 43% are white, and 8% are other or unknown. The source of all local cases is as follows. 83 are imported, 90 are local transmission with a known contact, 21 are local transmission with an unknown contact, and none are under investigation. Bermuda's country status remains at sporadic cases, and the 7-day average of our real-time reproduction number is less than 1. I would like to encourage returning residents to take particular care and follow enhanced precautions during the time between having their pre-departure test and boarding their flight back to Bermuda. Consider everyone you come in contact with as a potential carrier for COVID-19. Wear your mask, be extra vigilant in avoiding those who seem unwell, keep at least 6 feet distance between yourself and others, wash your hands often, carry a travel-size bottle of hand sanitizer and use it frequently, avoid crowds in any situations where you are unmasked with others in a poorly ventilated space. As you will have all hopefully heard by now, the CDC has reclassified Bermuda from Travel Health Notice Level 2 to Travel Health Notice 0. Level 0 means a travel health notice does not apply, or in other words, that Bermuda's rating has been revisited to the lowest possible level. This is extremely welcoming news, and this change comes as a result of negotiations led by the Ministry of Health with the assistance of the Caribbean Public Health Agency, or CARFA, and Government House, and is a testament to Bermuda's strict testing regime and public health protocols. Our team has been working hard to keep the island safe from COVID-19, and our efforts continue to be recognized internationally. This change in our status with the United States Center for Disease Control will hopefully encourage more visitors to come to our shores and continue showcasing our strong and resilient island home. Previously, Bermuda was listed as an alert level 2, and the CDC recommended people at an increased risk of severe illness from COVID-19 to avoid non-essential travel to the island and practice enhanced precautions. More recently, the governor of New York, Andrew Cuomo, said he required a 14-day self-quarantine when travelers returned to the state of New York from any level 2 country, which of course was Bermuda. This led to difficulties for persons hoping to visit Bermuda, and if not rectified, could have put flight capacity to the island at a risk. Investigation by the ministry determined that countries rated level 0 or 1 were exempt from the quarantine requirements of the state of New York. Again, I want to congratulate all involved who worked with the Center for Disease Control via CARFA and other channels to secure Bermuda's reclassification. One topic now which I'd like to touch briefly on is workplace guidance in a COVID-19 world, specifically offices. I've heard several questions raised recently about mask wearing, meetings, physical distance requirements, and remote working. There is an abundance of workforce-specific guidance on our government website at coronavirus.gov.bm, but I will provide you with a few key points now as it relates to office environments. Employees should work remotely if possible. Consider using team bubbles for office staff. For example, 1 week half the staff are in the office and the next week the other half are in the office. Encourage employees to stay home if unwell. Encourage employees to wash hands or use hand sanitizer often. Employees should work 6 feet from others or 3 feet if wearing masks. Staff should hold virtual meetings when possible, and where remote meetings are not possible, staff must be 6 feet from others and no more than 10 persons in a meeting. Employers should review options for increasing ventilation, consider air purifiers, for example. Employers should also review how persons enter and leave the workspace. How can you reduce the overlap of employees and increase disinfection? Where located in a multi-office building, identify designated entry and exit points to minimize workers' contact while moving through the work site. Employees should wear a mask whenever moving around the office. And finally, consult the return to work recommendation for businesses, again at coronavirus.gov.bm. There's special guidance for returning to work after travel, also on that website. As a reminder, the remaining October Flu Express location is the Clock Tower Dockyard, and that is on Wednesday, the 28th of October, from 10 a.m. until 2 p.m. During the month of November, the flu vaccine will be available at the Hamilton Health Center in an outdoor setting using a pop-up tent between the hours of 2 p.m. and 4 p.m. on Tuesdays, Wednesdays, and Thursdays. The flu vaccine is a safe and highly effective method of preventing most cases of flu, so we would encourage members of the public to go and get your flu shot. Before I conclude my remarks for tonight, I would like to remind people not to go to the hospital or health centers if they are self-isolating, quarantining, or symptomatic without first calling ahead of time. Stay safe, Bermuda, and remember, I wear a mask to protect myself, and you wear a mask to protect me. Thank you.
Thank you, Minister. And I would like to publicly thank your team at the Ministry of Health for working to revise our rating in the United States by the CDC. As a minister responsible for tourism, it is certainly welcome news. And just like you, I'm grateful for all of the agencies who assisted us in that regard, from Government House to the U.S. Consul General to CARFA, and all the persons who certainly have gotten us to a place where we're recognized for being incredibly low risk. As we transition to what I will speak about today, I just want to touch on the fact that many stories of countries who had COVID under control and no longer have this virus under control. There are many countries who bragged that they were COVID-free and are now dealing with community transmission of this virus. We do not want this to be us. I know I sound like a broken record. Every Tuesday, all the social media posts, everything else. But the fact is that though the pandemic fatigue is real, pandemic fatigue is precisely the thing that will lead us to a place where we can see our economy being damaged again because of restrictions which may be necessary to protect life inside of this country. Bermuda is another world, but Bermuda is not immune. And this can happen to us if we are not careful. We do have an incredible testing regime. We are able to host events in Bermuda. We do have the capacity to do things that other countries do not do. But all of this can fall aside if just a few people act reckless, persons do not obey quarantine regulations, persons find themselves slipping up, and we can have 1 to 2 to 4 to 16 and so on and so forth. And that is not where we want to go. So it is vital that we continue to follow the public health guidelines. By way of example, Ministry of Health and the Ministry of National Security have worked with Bermuda Football Association so that we can have up to 800 spectators at tomorrow night's football game. However, there are specific requirements there. And those requirements are social distancing and mask wearing to make sure that we can protect all persons. I want people to remember that these are not rules and regulations that are put in place because we feel like putting them in. They're not rules and regulations that are put in place because we like walking around at a football game and wearing a mask. They are rules and regulations that are put there to ensure that we can have football games in front of 800 spectators and that we can carry on our lives in a different and better place than many places in the world. So that is what we would like to do, and I must leave that with the members of the public, that it is vitally important that you maintain the public health restrictions, follow the public health guidelines, and do the very simple things that the Minister of Health will continue to remind all persons to do. I would like to offer condolences to the family who lost their loved one over the weekend and must now bury a father, a son, a brother, uncle, cousin, or friend who is the latest victim to lose his life to violence. As a country, we struggle to comprehend the loss of another Bermudian life. And while at the same time concerned about two others who find themselves recovering from injuries related to injuries sustained on Friday night from a gun incident. To provide support to those who live closest to where these violent incidents took place, and to help family and friends come to terms with the loss of a loved one, the Gang Violence Reduction Team, along with the Community Support Team, worked all weekend in Pembroke and Sands to speak to those who are directly impacted and to help to restore the sense of community that binds us together. The government is committed to continue its work to ensure that education, employment, community bonds, and a good quality of life helps young men see a future where fathers don't become fatalities and sons don't become statistics. The pandemic will not cease this work, as it is necessary to address the root causes of which the violence is just a symptom. Economic inequality and inequality of opportunity are the root causes of the violence, which is mostly confined to one segment of Bermuda, the Black community. Though enforcement is not a matter for the elected government, that is a responsibility of the United Kingdom government represented here by the governor. Tomorrow, there will be a meeting of the Governor's Council to discuss matters related to the police, and the ministers present will make sure that we signify the views and thoughts that we have in regards to the need to have effective enforcement, not only working with the police, but also with the judiciary to ensure that when the police do their work, the judiciary holds up their end of the bargain as well. I will spend a few minutes talking about education and the reform process which has started. In 2017, the government made a commitment to transform our public education system. This commitment wasn't ours alone, but reflected the aspirations of our community. We know that we have good schools and many great educators, but what we do not yet have is a universally excellent education system that meets the needs of all students and provides an education which is required for the future. Our promise, the promise that our community asks us for, was to do better for young people and their families. This means moving away from what we know is a traditional education that in too many ways resembles what education may have looked like many decades ago. While it has worked for some, it has not worked for all, as many parents and alumni can tell you. To that end, in March 2020, the Ministry of Education contracted with Innovation Unit, following an RFP process, who have extensive experience in the methodology of school system transformation to help carry out the transformative work needed for the execution of the government's desired school reform. It is important to note, as there has been a few people who have contacted me asking why we have contracted with an external body that has experience in this area to help design Bermuda's school system. That is not the case. Bermudians are designing our future school system. But what is necessary in an environment where you are dealing with change and complex change is that you need people who are experienced in change management, which is an actual discipline. And for that, that is the reason why Innovation Unit has been brought on board. the work of which is being put together regarding following the government's views on school reform has been led and driven by the Board of Education, consisting of persons who are affiliated with the school system, teachers, principals, former teachers, parents, many different working groups that have come together to make sure that we are designing and the school reform that we are engaged in is something that encompasses a broad cross-section of persons. But it is not something that is going to come from overseas. It is going to be something that is going to be born right here in Bermuda. As we are all currently experiencing so acutely, the world is certainly in flux. And we must not only respond to change, we must create change for Bermuda. And we can only develop the kind of public education system that the community demanded through that significant community engagement and public consultation. The Innovation Unit, along with the ministry's governance team, comprising of our local technical officers, have implemented a series of training sessions. These training sessions, I was here 2 weeks ago, and I had asked persons to go on the website and apply to be a part of the school design teams, and many of you answered that call and did go online and sign up to be a part of those teams. They held trainings all last week, and I visited a training session held Saturday morning, and I was very pleased to see the wide cross-section of participants who are willingly sacrificing their time to become the change agents needed for the transformation of our public school system. They are the first of many who will be equipped with the additional tools and skills in this change management process to reform public education and keep the pledge that was endorsed by the voters for a second time to phase out middle schools while introducing senior schools at the secondary level. The Minister of Education, the Honorable Diallo Rebane, will host a press conference tomorrow at 1 p.m. to provide the details of work of the Innovation Unit and what parents, educators, and the public can expect in the coming weeks. The press conference can be seen on the government's Facebook page and will be replayed on CI TV. Switching to tourism. Last week, I announced the appointment of NP Wayne Keynes as chairman of the Bermuda Tourism Authority Board of Directors. I was grateful that NP Keynes accepted my invitation. He has proven leadership in the private and public sectors and has extensive board experience, which I know will serve him well as he chairs that very important board. Mr. Keynes, with his talent and knowledge, will bring a dynamic approach which is necessary as the board must guide the Bermuda Tourism Authority to capitalize on this critical period in our country's history, while they also look to fill key vacancies within the Bermuda Tourism Authority. Before I move on to the next appointee, I'd like to wish NP Keynes a very happy 50th birthday. Additionally, Mr. Kim Swan also accepted my invitation to join the Bermuda Tourism Authority Board of Directors. Surely there can be no greater on-island ambassador for Bermuda golfers and the impact of sports tourism than NP Kim Swan. Anyone who has had a conversation with NP Swan will know that he promotes and recounts Bermuda's history in an oral tradition. While on the subject of tourism, Bermudians will have heard that the Bermuda Tourism Authority and Open Clear, a New York-based COVID-19 screening entity, announced a collaboration that offers tourists traveling to Bermuda access to an expedited screening service that follows Bermuda's health protocols. The service launched today, and appointments were made to take the test starting today. This is just the latest service to balance the need to be open to the world with our solemn obligation to keep Bermudians safe. And we are especially grateful to Delta Airlines, who also assisted in promoting the service by listing it on its website. Once again, for persons who are traveling to Bermuda or for residents who may want to travel back to Bermuda to make sure they have a pretest, they can avail themselves of this service at the Bermuda Tourism Authority office. As we work tirelessly to safely boost the economy and welcome more tourists, and as that effort picks up steam, we must be vigilant to ensure that we remain on the front lines of the battle against the spread of the coronavirus. To that end, and I've spoken about it before, about the technology tools which will be needed as we move into a period where we're seeing more cases worldwide, and sadly, a few more imported cases here. To that end, the government has partnered with We Health, a body formed from the research efforts of the University of Waterloo in Canada and Stanford University, who created COVID Watch, an app designed to track and trace COVID-19 exposures. Government's Information and Digital Technology Department has been running internal pilot programs to test the effectiveness of the We Health app. We are pleased with the early results, and Bermuda has been fortunate to work with developers to create We Health Bermuda, an app specifically designed for the island. We will be running public-private programs starting as early as next week, after both the Apple and Google stores approve its release to their platforms. Launching the app is one part of the solution, as it is only as effective as the users make it. It is the government's hope and expectation that Bermudians will download the app so its data is accurate and timely, and additional information will be provided in the coming weeks. One of the things that is certainly under consideration is to possibly add qualifications that for attendance of large events, persons will be required to have this app on and activated, which will certainly help in contact tracing efforts for the government if in the case there is an outbreak. As I said, the pilots will launch next week, and in the coming weeks, I'll be happy to update members of the public on what we're doing there. But it is certainly something that the Department of Information and Digital Technology has been working on, and we're pleased that we are now at the point where Bermuda will be able to launch an app, which is specifically not one of the early rushed apps, which did not necessarily work, but one that is specifically on the Google and Apple protocol, which meets all privacy requirements, which ensures that your data stays private, but can ensure that we can tackle any outbreak which may happen in Bermuda. And it's just another example of the government making sure that we are taking our time, working with the persons who have experience in this area so we can deploy solutions that can certainly serve this country well as we continue to battle the coronavirus. So with that is the conclusion of my remarks, and I'm happy to take any questions that members of the media may have.
We'll start with Bermuda Broadcasting.
Pleasant evening to you both. Don Burgess for Bermuda Broadcasting. With the case today, Health Minister, we've now had 9 cases in the last week. That is the most in a 7-day period since May 22nd to 28th, when there were 15 cases. Is this signaling the start of our second wave?
Well, Don, as the Premier indicated, we've seen many countries in the world who have heretofore had announced that they were COVID-free, and now because of certain circumstances, they are now seeing their own second wave. So we do know a second wave is occurring in many countries throughout the world, and that potential can be reflected in the numbers of visitors that we have here coming to our islands. In addition to that, we do have quite a number of more visitors that are arriving for a number of events sponsored through tourism and so forth. And obviously, visitors are required to take tests upon their arrival, and therefore, because we're testing more, we're going to see more. But certainly, the impact of the world having a second wave, and we're having more visitors to Bermuda, we would certainly expect that to be reflected in our numbers. However, having said that, that's why we have such an aggressive testing regime. As I've said previously, if you are a visitor to this island, you must have a pre-test. You test on arrival, you test on day 4, day 8, and day 14. For locals, residents of Bermuda, if you do not have a pre-test, then you test on arrival, you quarantine for 8 days, and then you subsequently take another test at day 14 and test out. Day 8 and day 14. So we do have a quite aggressive testing regime, and that allows us to do more protection at our borders.
Would you consider more of a second wave than if it was local transmission happening rather than people coming in on flights?
If we get to a point where we do see more local transmission, certainly we don't want to get to that point, or certainly not community spread, then we would, the classifications come out, so we would certainly be probably classified not as sporadic cases, but having local cases and a second wave.
If we do have a second wave and the virus gets into the schools, what is government's plan to tackle this? We know we've seen children 7, 9, and 10 recently over the last 6 weeks become infected.
The Ministry of Education, in conjunction with the Ministry of Health, are working on an outbreak plan, and that's being finalized. And as the Premier indicated, Minister Rebane is actually doing a press conference tomorrow, so you may be able to speak to him about that. But we are in the final steps of working on that outbreak plan. And you'll also recognize that if you look at the COVID at our website, we do have an exclusion processes for children that have either tested positive or children that have returned home or members of their family that have returned home. And all that can be found at our website as well. So we do have protocols in place for children who are living with residents, living with persons that have actually traveled, or children themselves who have traveled, with respect to when they can return to school.
Thank
you, Don. Let me just add to what the Minister of Health has said, because what she said is absolutely correct, that, we're not flying in this blind. And if you look at the volumes of information that was produced by the Ministry of Health and the Ministry of Education on returning to school, on all the various protocols, et cetera, there's a significant body of work there. What I did charge the Minister of Health with, and also the ministers who are sitting on the COVID committee, which would be the Minister of Public Works, the Minister of Transport, the Minister of Education, the Minister of Health, and myself as the Minister responsible for tourism, is to update the plans of which we have, because we have new tools at our disposal. These were plans that were put in place in June and July, and to update them to say that now we have more tools at our disposal. What are the different approaches of which we may take, which will be possibly short of sending everyone home, but making sure that we have certain tools at our disposal that we can tweak. And so that's the work that has been happening. I know the Ministry of Health is engaged in that work. As the Minister of Health has said, the Minister of Education has been engaged in that work insofar as updating our outbreak plan, given that we are, a few months into the school year, and we do have different experiences and can have better understanding about how we go about that. But that's been happening across the government, and that's what's important. The government is not just standing still. The government is taking into account the changing circumstances which continue to work, and continue to remain focused on updating our plans and policies so that we can be nimble in responding to the virus. The direction that has been given is that we don't want to wait until these eventualities happen for us to start planning for those eventualities. So we've been planning for various eventualities, and as we've seen this increase in cases globally, and we see that the increase in imported cases, especially when we're seeing an increase in day 4 and day 8 cases, which is what we did not see beforehand, they're indicating some other things. And so we're going to make sure that we are flexible and adjust, because the last thing we want to do is to become like those other countries who have had the opportunity to roll back. But I think a key point of what the Minister of Health has said is that there is certainly a minimized risk for persons in schools, because we will know that the policies of which the Ministry of Health has laid out, and certainly which is applicable to public schools, and I think are applicable to many private schools, is that anyone who has traveled or anyone who lives in a household of someone who's traveled is not allowed to attend school for those full 14 days. And that's part of the reason why I'm not going anywhere, because I want my children in school.
Just to piggyback off your 8-day comment, are we seeing any of these people who have tested negative on day 4 and then tested positive on day 8? Is there a specific number for that?
Some of them have tested day 4 and have tested at negative on day 4 and then positive on day 8. Some have been local residents who have not had a pretest, so therefore were required to quarantine for the 8 days, and then tested positive on their day 8.
Okay. Does it cause any problems then for the tourist who tested negative on day 4 and were out and about in the community, going back and doing contact tracing to where they've been?
Well, let me answer that in 2 ways. One is with respect to the contact tracing. Obviously, when persons arrive to the island, in particular persons that are not resident, they're all required to complete a TA, and the travel authorization has all the details, contact details and the like, of that particular individual, so that if in circumstances are such that we need to contact them for contact tracing and the like, we can do that. We have a very skilled team of contact tracers. They're like investigators, so they've been doing this, unfortunately, for several months now, so they're very proficient in it. So they obviously get to work immediately when there's a case identified. In addition to that, and I just lost my train of thought. What was the first part of your question? I'm sorry.
I'm lost a little bit too.
Oh,
But like on the
Oh
people.
yes. You've heard us speak about the mobile quarantine, and that's really, really important. I need to emphasize that. We can't stress it enough that notwithstanding that you have had a day, if you're arriving into Bermuda, whether you're a resident or a visitor, and you've had a day 4 test, and you are it is negative, and you have other subsequent tests that you need to take, depending on your length of stay, we're still encouraging everybody to avoid the C's, closed-in spaces, crowded places, wear your mask, make sure that you practice physical distancing, safe hand hygiene, et cetera. All of those things have been proven time and time again that they can help reduce the transmission. So if you are a traveler or a person that has returned home to Bermuda, resident, we're just encouraging everybody to maintain all of the public health requirements that we speak about. It's called mobile quarantine. Don't go into crowded places when you've only just come back from away a couple days ago, right? We're just encouraging everybody to be responsible for their own actions and recognize that their actions adversely could impact others if they don't adhere to our public health guidelines.
And it's key to note, very important, as the Minister of Health has stated, as you have, and I would sincerely hope that members of the media will reflect this in the coverage of which they have. As you've heard the Minister of Health say many times, a test is just a point in time. So where you have individuals who would be tested 4 times in the space of 2 weeks, negative pre-tests, negative tests on arrival, negative day 4 tests, and negative day 8 tests. Just because you have a negative test does not mean that you cannot become a risk. And so it is key that we recognize and understand, and that's the reason why there's been significant health guidance that's put out, and that helps to reinforce the issue. So I sincerely hope that your media organizations will reinforce that to the persons who watch and read your news.
Okay, thank you. We see a lot of mask wearing. We see a lack of mask wearing inside the cramped broadcast center at the recent Rugby 10s event at the National Sports Center, with many of the foreign staff working in cramped and unventilated condition indoors, with some Bermudians being forced to work side by side with them. Some of these foreign workers have flown into work on the event and apparently have not had to go through day 8 tests before they are working here. What instructions are being given to the sporting event staff, not the players, so that they don't import the virus and infect Bermudians?
With respect to the organization of these events, all of the organizers are provided with full comprehensive guidelines as to what is required, similar to what I just spoke about previously concerning the mobile quarantine and the other public health guidance. So they are presented with that information so that they can do what is necessary to ensure that not only the participants but those persons that are attending those events are adhering to proper public health guidelines. However, it's incumbent upon each and every one of us to also adhere to those. So if you are at an event and it's a large gathering, such as a rugby or whatever, wear your mask, practice physical distancing, wash your hands, keep your hands out of your mouth and your eyes and so forth. We all have to do that. And I know it sounds so trite, but that's the only way we're going to stop the transmission. So notwithstanding that we are providing this guidance to the organizers of these events, the persons that are attending also have a responsibility to protect themselves and others.
And just one thing to add there. That is a report which I noted in the questions which you sent earlier. And I'm certain that will relate to the Ministry of National Security, because if that is in a case where they are in a closed and enclosed space, not wearing masks, they are violating the public health guidelines, which I'm sure the Minister of Health has laid out, and that is not something that is acceptable. And given that this is something that was also sponsored by tourism, I'll make sure to say something myself, as we want to make sure that we keep our community safe. And as you said, in that case and instance, it only takes one.
All right. Thank you very much.
Good evening, Minister. Good evening, Premier.
Hi, Ms. Velasco.
My first question will go to you, Minister of Health. Is just to reiterate, what is the age that a child should be when they are shopping with their parents in stores? Should be wearing like a mask? Because some persons.
Sure. The requirements that are under the guidelines say that all children should wear a mask except for those under the age of 2.
Okay. Thank you. And to Mr. Premier, when will the public be able to hear an announcement for the new leader of the Senate?
That will happen before the convening of Parliament, which is next week, Friday, November 6th.
Okay. And my last question may go to both of you. In recent times, Bermuda, we've seen a lot of violence going on. And even when it comes to the murders, and the one example I could give of the custody of a 19-year-old for the death of 31-year-old Miss Can, they all seem to be in a very low age range of like 20-year-olds that these violences are like happening to. So what does that strike us like as a country as to why is most of the recent violence happening by people that are so young? Like, what does that say mentally and also for the state of our country?
Happy to answer. It's as I said in my remarks, the violence is a symptom of a bigger problem. And the bigger problem is the challenge. It's no, I'd say, coincidence that the violence is largely in one sector of the community in Bermuda. And this is, as I say, a symptom of economic inequality and inequality of opportunity and systemic racism, of which has been a challenge that Bermuda has had to deal with. I believe that our government is making progress. I do not think that anyone thinks that we are making enough progress, and we want to make more. And when we look to the convening of Parliament next week, when we look to the things of which we laid out in our election manifesto, when we look to the drive to make sure that Bermuda is a more fair society that provides more opportunities, that recognizes the fact that some people have head starts and others don't, those are things of which we have to be very clear about and to speak about. I know that when people ask me when I used to travel, why was I engaged in politics? And I would just go with a simple mantra, and it was for the young men who lived in my constituency, which you were in this weekend, who don't necessarily see a future for themselves to have opportunity inside of their country. And that's what it is. It is a indictment of our collective governance, that there is not enough opportunity for persons, so they fall into these cycles. But as I said, it's not a, it is something that we have to deal with. It is something that we have to admit where the causes are from, and then we have to be very forceful in addressing those particular symptoms of the cause. Symptoms of the violence. And the cause is economic inequality, inequality of opportunity, and systemic racism, which we see throughout this country, whether it's in our criminal justice system or others. So while we make revisions to laws and while we make revisions to other things, we have to remain laser focused on the fact that this is about sometimes intergenerational challenges that we have to deal with.
Thank you. Those are my questions.
Well, with that,
And Maya, I just want to say congratulations on this weekend. I didn't know you were such a singer.
Good evening.
Good evening.
Hi. We had a press conference from Renee Ming, National Security Minister, this week, talking about, reminding the public about large gathering protocols. And she alluded to the fact that there had been an increase in applications for these large gatherings. I guess we've got Christmas coming. Is there anything you can expand on in terms of how much it's increasing by these applications?
I can promise you I don't have those statistics, but I know the Minister of National Security would not have an issue replying to those. But I think it just speaks to this balance of which we have to strike. I think that it's important, and I think that it's a good thing that the Ministry of National Security is able to issue these large event permits. And we have been reasonably successful in containing the spread of the coronavirus to our shores. But every permit of which she issues now has the provision that it could be revoked. And at any time, if we don't follow the guidelines which are necessary, we can find ourselves in a place where we can see us having to reduce the amount of persons who can gather, to reduce the possibilities of these large spreading events. So I know that she's been very careful to not improve indoor events. Most of the events are outdoors. As we move towards more inclement weather, that may be more challenging, and that's all the more reason why it's important for people to, as annoying and irritating as it may be, to wear masks.
Mm-hmm. And great news about Bermuda being downgraded to very low risk. Do you see that having a major impact on tourism and the number of visitors we get?
I'll yield to the Premier with respect to the tourism aspect, but I think it's also important to note that there's quite a number of individuals that are students that are being educated in New York, for example. And because of this particular previous level rating, if you return to the United States following Christmas break or so forth, you obviously had to New York, you had to quarantine first before you could commence your schooling. So from that aspect is obviously very encouraging. In addition, the fact that I think I found particularly egregious about the decision was the fact that they weren't obviously conscious about our testing regime, the fact that we had sporadic cases, all of the other information that is been made that's relevant to the decision of putting us on a level 2. So the fact is, it was unwarranted entry into the level 2, but at least it's been rectified.
Undoubtedly, it will have an impact on tourism, especially when we're talking about the New York routes and whether or not any other states wish to, enact the similar restrictions which we were facing for travelers traveling to the state of New York. So it's certainly a benefit. I continually reference the fact that British Airways is increasing flights, which may make the Minister of Health nervous and me a little nervous as well, given the situation over there in the United Kingdom. But because persons who return from Bermuda do not have to quarantine upon their return, and that is something that is critical. And you can see the opposite relationship when it deals with the situation in Canada, where Canada just has a blanket requirement for any person entering the country, whether they be Canadian or not, no matter what country they come from, a COVID-free jurisdiction, or other countries which have lots of the coronavirus. And so we've seen the dampening effect that that's had on the desires of flights from our Canadian partners to increase. We've certainly seen that demand is there for travel. We're certainly seeing the demand is there for safe travel. And so we are continuing to push forward in that aspect. Bermuda is not the easiest place to get to, and Bermuda is not the easiest place in which to be when it comes to our coronavirus protocols. It's not. There are other countries that have far less protocols than we do. But there were other countries, as I said, who boasted that they're COVID-free and only required an entry test, and now have community transmission of the virus. So we are comfortable with where we are. Though, as the Minister of Health has expressed, though there are increasing imported cases, and we're seeing these day 4, day 8, we are still confident the measures of which we have put in place will minimize that spread. And because we have significant testing capacity of which we can use, and even emergency testing capacity if we had to expand, then with the private labs as well as the government labs, then we're sure that we'll be able to tackle any outbreak if one were to occur.
Okay, thank you. Moving around to the BTA, Premier, is the BTA losing its independence with having Wayne Keynes in the top seat of the BTA, he being affiliated with the PLP as he is an MP?
Who said the BTA was independent?
I'm sorry?
Who said the BTA was independent? I'm wondering if that question was asked when the former government appointed a former UBP Minister of Tourism to chair that body. Just stating. Who said the BTA is independent? The fact is the Bermuda Tourism Authority. The fact is that the Bermuda Tourism Authority receives significant funding from the government of Bermuda. There is always significant discussions, and with its operations, the Bermuda Tourism Authority comes to the capital of Bermuda on a regular basis to ask for additional funding for various projects and items. So I don't accept or buy. The fact is, if tourism does not do well here, no one calls for the chairman of the BTA's head. They call for the Minister of Tourism's head, and the government is the one who's responsible for it. I have no doubt that MP Keynes will be able to execute his responsibilities very well. As I've said, he has extensive experience serving on boards. He's already hit the ground running, and I believe that he will add great input there, and I'm looking forward to what will come out of that body. But I reject fully this whole notion of independence. The fact is that it is a taxpayer-funded entity, and you can't have taxpayer-funded entities and independence at the same thing. I don't think they work, and they don't work for me.
And moving around to the violence that we've experienced, you talked about the gang violence reduction team. They've been working around the clock. I'm just looking at their name, the Gang Violence Reduction Team. We've seen an increase in violence. Are you satisfied with the work that's being done with this entity? Do you believe that it needs any enhancement in light of this increased bout of violence that we're experiencing?
Am I satisfied with the work? Unquestionably. And I know the significant amount of energy and effort that is put in by Pastor Leroy Bean and his team, so undoubtedly. The fact is that, what do they say? Success is many fathers, and failure is an orphan. The fact is that very few people were singing Pastor Leroy Bean's praises last year when we recorded very minimal fatalities. I think there was none. So the fact is that, you know, we didn't get here overnight. We're not going to get to this situation overnight, and we're not going to get out of this situation overnight. It is going to take continued targeted work. It's going to take continued community work and community efforts. I know the significant work that Pastor Leroy Bean does behind the scenes. He enjoys my full and absolute confidence. The Minister of National Security will continue to work inside of that construct and will enhance whatever needs to be enhanced in that perspective. So on that, I certainly have no doubt. So the basis of the answer to your question, yes, Pastor Leroy Bean enjoys my full confidence. I have seen firsthand the amount of work of which he does. I've seen the impact of which he's had in the community, and oftentimes, and it's a very difficult thing to say, and it's hard for persons to understand and to get, but I can say without fear of contradiction that without the efforts of the gang violence reduction team, the situation in the country would be far worse.
Okay, and my last question, covering all bases here, education.
No problem. Go ahead. There is a press conference tomorrow with the Minister of Education. Go right on.
We got the premier here. And you might not have the answer to this one. But you mentioned that there was an invitation for a design team, which is an incredibly important role. This is the future of the transition here. Mm-hmm. Now, it's my understanding that there wasn't a very long period for that invite to be honoured, for people to come forward. I know of one entity who had found out about it on Facebook, and the deadline was the following day. And I understand that the government had missed an advertisement deadline. So I don't know if you can give some clarity on exactly how long people had to submit.
I can't submit
to
clarity.
Yeah.
I do know that I believe that it may have been in your newspaper that is circulating. I know that it was found online. I know that it was voted here. I know that it was actually shared out in email to parents as well. So from the perspective, I mean, the amount of applications that came in were about, I want to say, don't want to call it a number, it was higher than 100 but lower than 200. And so these are persons who are participating in that. In that aspect, but I think that it's a very good cross section, and as I said, I attended. Not everyone could be chosen, so I don't know the exact numbers how many people were chosen to participate from those to apply, but it was a wide array of current teachers, current administrators, former teachers, former administrators, principals, parents, people who were involved in the system, people who were from the third sector, to be a part of that change management team. And so I think that it's certainly, I'm gratified by the persons who did apply. I'm gratified by the fact that there are persons who took out a significant amount of personal time. I know there was an educator who lives in my constituency who was dying to get involved and was worried about the time commitment there, because it's not just, show up to one meeting and you're finished. I mean, it's a serious time commitment. And I'm grateful for those persons who have put themselves forward for this very important public service. But I want you to make sure, and I think you can ask those questions tomorrow, to understand the process of which is gone. This is not, these people aren't starting from scratch. There's been a significant amount of work that has been done by numerous stakeholder groups, significant amount of work that has been done by the Board of Education to get us to this point of looking at the various options, understanding where it is that we need to go. And now we're basically getting to the point now where we're going to move towards implementation. So we need more persons basically on the team who understand the mission, who understand how to execute change management, and to be a part of that change. And so we want to make sure that what is going to be designed is actually going to work for us. And I have seen some of the proposals that have come out, and I am looking forward to the public consultation that will take place, because I am certain that the parents of this country and the citizens of this country who want to have a strong and vibrant public education system will give what they see a vote of confidence.
Okay. Thank you.
Thank you very much, Sarah.
Premier, there are no more questions?
All right. I want to thank the members of the media for their attendance, thank them for their questions, and I wish to remind all persons to continue to adhere to public health guidelines. It's necessary and essential. I know that it is very hard to resist the urge to shake hands, very hard to resist the urge to hug, very hard to resist the urge to, be in closed spaces and not be in safe spaces. I have to remind everyone that it only takes one, and this virus is still with us. We have seen what has happened on the news. We have seen what has happened in other countries, and it is up to us to ensure that it doesn't happen in Bermuda. We got this far together, and we will only be able to maintain this very proud story if we continue to work together and to follow the Minister of Health's rules and directions. So with that, I want to say thank you all, and good night, Bermuda.